Hey everyone. Cannabis and medicinal cannabis is becoming more and more popular, and I know a lot of patients are curious about this. And I think more and more people are now trying it for different medical conditions. I often see patients come in and they are trying it for things like anxiety, to help with insomnia, to help them sleep better. And so the question comes, is cannabis for fertility friend or foe? And it's an important question because of its widespread use and infertility being a widespread disorder with up to 10 to 15% of couples or single parents being affected by this issue. It's important to consider the ramifications that something like cannabis may or may not have. So the evidence-based approach to cannabis is quite in the early stages for fertility, and there are not a lot of studies on the topic. A lot of them are very small sample sizes, but we're seeing a trend, and the trend is that the use of cannabis seems to be having a negative impact on implantation rates, particularly. So it's important to mention that naturally in the body we have something called endocannabinoid receptors, and these receptors are also present in the endometrium, sperm cells, the ovaries, and it's important for these receptors to be activated by endogenous ligands that we already make, such as anandamide. And this ligand has a very key role in helping the uterine lining to mature, to help make it optimal and ideal for something like embryo implantation to occur. It seems to have a role in um, impacting ovulation, follicle growth. So why is it that we have these endocannabinoid receptors in the body, but cannabis consumption seems to have a negative impact on fertility? So the early research that we're seeing suggests that with chronic or occasional cannabis use or CBD oil, these cannabinoids seem to flood the body and flood these receptors. So imagine like a keyhole, and instead of you being insert the correct key into that keyhole, we have another key that we put instead, which can't open that door. And so it's blocking you from putting the correct key into the keyhole, but um, and it can't, obviously activate that receptor. That's the analogy. So basically, the cannabinoids from cannabis use or CBD oil will bind to these endocannabinoid receptors in the reproductive system and block the actual endogenous cannabinoids that we have from actually exerting their effect on the reproductive tissue. So it's been suggested that it can affect sperm motility, sperm concentration potentially. But the biggest one we're seeing in a latest research paper published this month is that it seems to also impact the ability of a healthy embryo to implant in the uterine lining. And it's also important to mention that cannabis use during early pregnancy seems to have very deleterious effects on the health of the pregnancy as well. So there's a significantly increased risk for preterm labor and other negative health complications during pregnancy. So it's something that during the prenatal period, when you're preparing to conceive, we usually recommend patients to discontinue the use of cannabis or CBD containing products, just because there is a lack of research around the area, and it's not, we're not completely sure what the safety or the risk level is, but all these early studies are showing a concerning trend where exogenous cannabis or cannabinoid consumption seems to have a negative impact on sperm fertility, uterine fertility, ovarian fertility. So for that reason, we usually recommend avoiding such products. And in some cases, it can take up to 3 to 5 months that we've seen, after discontinuing, that the cycles may start to become more regular. So for patients that have had irregular menstrual cycles, sometimes it's actually one of the causes of that is cannabis use, even irregular use. There was a study published a while back that even mild occasional use, in a month or so, seems to have a negative impacts on the cycle regularity and regular ovulation. And yeah, cutting or removing cannabis use may take a bit of time for the cycle to actually recover and come back to its normal rhythm and balance. So it's best to avoid it. I think future research might give us a better understanding of how harmful, or if it really we see in larger, better quality studies if it is actually confirming these early reports. But for now, based on the available evidence, it would probably be best to avoid. So it's important you speak with your licensed healthcare provider if you are using cannabis for a medical health condition to find other safer alternatives that you can try, that your health provider can recommend, in exchange for trying something like CBD oil or cannabis, at least while you're trying to conceive and once you're pregnant as well.